In this segment, I'm going to talk about anesthesia. The most fearful experience people have is when the dentist pulls out one of these. Okay, we've all felt it, all experienced it. And why is that? Well, when we look at a normal syringe, firstly, it does look a little bit intimidating. When the dentist pulls off the cap and you see this long needle and you know it's going to be stuck into you, that's pretty scary. But why does it really hurt? It doesn't hurt so much because of that tiny little needle being pushed into the tissue. What hurts is when we squeeze this fluid into your gums. It's the pressure of this fluid. So if we can get this fluid to go into your gums, much easier, slimmer, slower, safer, it's going to be virtually painless. So we've recognized this as the dental profession, and at long last the company has come out with a device that's actually going to do that for us. And it's this device here, which we have sitting here, called the STA, single tooth anesthesia. It still uses or employs a little needle, but it's pretty tiny, very, very tiny. Certainly less intimidating, this little plastic thing that you see. But the beauty about this device is that all it does is drop one tiny little drop of anesthetic every couple of seconds. Okay, so this is how it works. Now, because we're only dripping one drop of anesthetic at a time, the pressure of the fluid pain is gone. But some people still may feel a little sensitivity or uncomfortable with the actual needle touching the tissue. So we can't put some topical anesthetic also before we do that. So after we've placed topical, or if the patient chooses not to, we will just place this in the area that we want to get numb and let the machine do its job. It'll dispense all the necessary amount of solution in a controlled manner. Once it's done, the only thing that's going to be numb are your teeth and the edge of the gum tissue, not your lips. You're going to be able to smile. You don't have that fat face. The same will apply when we get down to the lower. If we're just going to do one tooth, we can put a little topical anesthetic there also. Place the needle or the wand right next to the tooth. Let the machine control the dispensing of the solution. It'll even tell me if I'm in the right place. Once it's done, tooth totally numb, no lip being numb, no tongue being numb, none of that big needle going way back into your throat and numbing you up. So this is really the most wonderful piece of equipment to make your dental experience that much more comfortable. So if you're a patient that's going to be undergoing dental therapy, which is going to require some form of anesthesia, when you come to me, we're going to use the single tooth anesthesia to make that experience as pleasant as possible.